Hello, my name is Olamipo Adekoya, and this presentation is about medication non-adherence. I'm a family nurse practitioner, and this is an issue I've seen in my own practice. Patients stop taking their medicine as prescribed or as directed for various reasons, and this has grave consequences on their health. We'll find out more information in this presentation. So, what is the problem? Adherence is the degree to which a person's behavior, both medication taking and otherwise, lines up with agreed advice and counseling from a healthcare provider. This includes the initiation, implementation, and discontinuation of therapy. It could be primary or secondary. Primary Primary non-adherence is related to the initiation of medication therapy. It is the inability of a patient to fill prescriptions when new prescriptions are prescribed or refilled. On the other hand, secondary non-adherence is filling a prescription but not taking it as directed. Anyone can be non-adherent to their medication. I've had patients who are on a 7-day course of antibiotics stop taking their antibiotics on day 3. But patients who have chronic healthcare conditions are usually the ones who are more non-adherent because their therapy requires long-term medication administration and follow-up. So after a while, it gets hard to keep up with taking their medications as prescribed. Medication adherence to chronic medication therapy on average is about 50%, regardless of the type of the disease, complexity of the medication regimen, or how adherence is measured. There are many reasons why patients are non-adherent to their medicine. Some are patient-related factors, provider-related factors, or healthcare system-related factors. Patient-related factors are divided into two. We have unintentional factors and intentional factors. Some unintentional factors include forgetting to take medicines, a lack of understanding or education of the dose and the regimen, or a lack of access to the pharmacy. And then intentional refers to deliberately deciding to discontinue or adjust medication regimen for any reason. It could be because the patient does not like a side effect of the medicine, or they thought they would feel better by a certain period, and after that they weren't feeling better, so they stopped the medicine, or they can't afford the medicine. Other patient factors are memory impairment, substance use, mental health conditions such as depression. And then we have provider-related factors. These include inadequate communication with patients, difficult medication dosing schedule, inadequate coordination of care among various providers. If a patient has 3 doctors, probably they're diabetic and hypertensive and maybe have cancer, they are seeing a cardiologist, an endocrinologist, and an oncologist as well. So sometimes it gets hard to manage all the expectations and medications from all those providers. Healthcare system related factors include restricted amount of providers available to prescribe or refill medications, limited drug coverage, elevated cost and high copays, unclear medication labeling and instructions, limited time for prescribers to explain benefits, risk, and alternatives to prescribed medications. In primary care, for an established patient, the visit time usually runs from somewhere between 15 minutes to 20 minutes time slots, and then for a new patient, about 30 minutes. So it's really hard to gather a detailed history, do a physical exam, come up with a treatment plan, explain that treatment plan, and then explain medications in depth to a patient so that they understand. So times that time lapse gives room to misunderstandings between the patient and the provider. This picture has a graph that just outlines some reasons why patients don't take their medications from a study that was conducted. The highest being that they forgot to take their medicine. And then the least reason, kind of tied, two reasons tied. One is that the patients felt they didn't have a reminder or they had a problem getting their prescriptions filled. Some other reasons giving, patients thought that they didn't need their medicine, they didn't like the side effects, their symptoms disappeared, or they just wanted to save money. So these are some reasons why patients don't take their medicine. Okay, is it really that bad? Let's take a look. So every year in the US, about 3.8 billion prescriptions are written. Among new prescriptions, about 1 in 5 never get filled. And of those that do get filled, about 50% are not taken correctly in regards to dose, time, frequency, and duration. Although the rates of non-adherence has remained somewhat stable, direct healthcare costs have grown to approximately 100 to 300 billion yearly. Annual medication non-adherence costs range from about 100 to 290 billion dollars in the US, about 1.25 billion in Europe, and about 7 billion in Australian dollars. That's a lot of money. About 10% of hospitalizations in older adults are ascribed to medication adherence. And then the classic non-adherent patient needs about 3 extra medical visits per year, which in turn leads to about $2,000 in extra healthcare costs for their treatment annually. This is a serious issue and should be taken very seriously. The World Health Organization, in its 2003 report, stated that improving medication adherence has the potential to significantly affect the health of a population when compared to any advancement in specific medical treatment. So, if we think about it, what the WHO is saying is it's good to add other interventions to get patients to have better health and feel better. But if they're not taking their medications as prescribed, all those efforts are going to be counterintuitive. So it's really important to get patients to start taking their medicine the way that it's prescribed, as this would help the patients in the long run better than any other advancement in specific medical treatment. Non-adherence leads to increased healthcare costs, morbidity and mortality, poor clinical outcomes, and higher rates of hospital admissions, and even readmissions also. Because if a patient, for example, is to the hospital for high blood pressure because they were not taking their blood pressure medicine as prescribed, or they ran out and couldn't afford to get it refilled, if they get treated in the hospital and then get discharged, they're only going to come back for the same thing if they don't treat that issue and get their prescriptions refilled so that they can take their medicine. Therefore, improving the rates of medication adherence would not only improve the health of the patient, but it would also reduce the economic demands and health burden of various illnesses and chronic diseases. This next slide has two pictures that are saying about the same thing, but just illustrated in different ways. So if we focus our attention on the one toward the left, it just gives us some statistics on medication non-adherence. So about 50% of patients do not take their medicines as prescribed. This leads to about 100 billion in excess hospitalizations. So if we think about it, and looking down, for every 100 prescriptions written, about 50 to 70 of those go to a pharmacy. So this can be the loss, the difference could be, we can attribute the difference to maybe patients get written a physical prescription and they don't take it to the pharmacy, they lose it in between, or now that we have electronic prescribing, for some reason the pharmacy is not getting that prescription. Of those 50 to 70 prescriptions, about 48 to 66 of them come out of the pharmacy. So about that number actually get filled. About 25 to 30 are taken properly, and about 15 to 20 are refilled as prescribed. Those are really low numbers. So this next slide has a little chart on it, and I like it because it kind of explains how healthcare costs are kind of recirculated, and a lot of times the patient doesn't realize it. So all the way at the top, we have poor medication adherence. This leads to poor health outcomes, which in turn leads to increased service utilization, which leads to increased healthcare costs, which then leads to costs passed on to the patient, which is something a lot of patients don't realize when they're using the healthcare system a lot more. So the financial pressure is passed by payers through higher copays or via higher cost to employers for coverage. Increased patient cost sharing beyond a threshold negatively impacts the level of medication adherence. So the more patients use healthcare services, after a while, someone has to pay for those services. And a lot of times it gets shifted to the patient through higher copays and or higher deductibles, but ultimately becomes patient's responsibility, which is something to think about. So what has been tried to fix this problem? There are some behavioral prompts or reminder systems, some educational methods, and organizational methods. The behavior prompts or reminder systems help especially with unintentional adherence. This includes pill boxes, auto refills, blister packs. But the downside about it is that it could be cumbersome for complex regimens and only passively reminds patients to take their meds. So, for patients who are taking multiple medicines, especially at different times, putting it in a pill box, for example, becomes really difficult to manage complex regimens, and it only having the pill box there only tells you passively you have medicines in there you need to take. It doesn't tell you what the medicines are, for example, or have any patient involvement. I've had patients who would come in to see me, and then I'll ask, they'll tell me maybe they're hypertensive. What blood pressure medicine are you taking? And then they say, oh, I don't know the name. It's the white round pill. And they expect me to know what the white round pill is. But there are many medicines that are white and round, so it's really difficult to know what's in the box once they've put it in their pill box. Another strategy is through education, counseling, and educational materials and pamphlets. Education actually is one of the best methods for improving adherence, especially in patients who are on multiple medications, about 6 or more. However, it becomes a problem if there is a language barrier or some form of cognition impairment. The other method is organizational methods, so through electronic pill monitors or mail order or home delivery options. But these methods do not involve the patient in self-medication process. They don't offer educational information or provide access to adherence data. One thing to keep in mind is when looking for an intervention to fix a problem, it's very important for healthcare providers to tailor an intervention to fit the reason for medication non-adherence. For example, pill boxes and auto refills and reminders address the problem of forgetfulness. So for patients having trouble remembering to take their medication, those methods help. Counseling and the use of handouts address the issue of lack of education or understanding, and mail orders and delivery options address the issue of access to the pharmacy. So it's really important when coming up with an intervention strategy to address what the issue is that's making patients non-adherent and find a way to fit an intervention to address that need. So for this project, I collaborated with three professionals that I know. One was a nurse practitioner, the other was a physician, and the last was a physician assistant. So the nurse practitioner works in a family practice and has about 15 years of experience, very knowledgeable, and treats all of his patients with compassion and utmost care. He does use mobile apps for his patients and attested to the fact that they're good and they help to improve patient outcomes. And he uses My Med Schedule Plus, which is an app that we would learn about in just a little bit. He did suggest to help make the app more beneficial, to have a way to create a chat forum between the healthcare team and the patient, where the patient can ask questions and discuss side effects or adverse reactions with the team. Unfortunately, I wasn't able to incorporate his suggestion into my project as the app's already been created. But he encouraged me to inform patients about the app, knowing that not all of them will agree to use it, but it doesn't hurt to try and still put the word out there. The next person I collaborated with was a physician. He's been practicing for over 20 years and he's much older. So during his time of training and early years of his practice, computer programs and softwares like electronic health records and definitely mobile apps were not available for use. But he has started using mobile apps in his practice to provide better and faster and safer care to his patients. So he did recommend the use of a mobile app. For his suggestion, he suggested having a folder within the app that has educational materials. So, and educational materials specific to different health conditions. So, have one for hypertension, have one for diabetes, have one for thyroid disorders. And they will provide education on reasons why patients are non adherent in order to help them disease specific conditions for their disease specific conditions. Unfortunately, again, the app has already been made, so there was no way to really incorporate his suggestion into the project, but it was a really good suggestion. And lastly, I spoke with a physician assistant who's actually my clinic partner at work, has been practicing for about 6 years and has a wealth of knowledge about hypertensive medications and managing chronic health issues. He's actually the on the National Chronic Care Peer Panel, peer mentoring panel at the company. He's constantly learning and updating our group practice on ways to better care for our patients with chronic healthcare conditions and comorbid health needs. Although he does not use My Med Schedule Plus, he didn't actually know about it. But when I explained the app to him and what it does, he was really excited and expressed how it would be really good to help improve medication adherence. He suggested having a platform where a group of friends or even family members can encourage and interact with themselves through the app and encourage their medication taking behaviors. That he felt this will provide support and just help to keep the patients accountable to each other. Unfortunately, again, the app's already been created without this feature, but he encouraged me to tell my patients to use the app and encourage their family members and their friends to use the app, and then they can discuss their progress. They won't be able to see what each person is doing, but then they can still have the app record their information, and then they can discuss it with their patients, kind of to generate some form of healthy competition. Utilization of appropriate technology. The possibilities are endless on what can be done on a smartphone. You can look things up on Google, connect with friends and family on social media sites, set an alarm, use a GPS, check the weather. Possibilities are endless. And the healthcare industry has been positively impacted by this advancement in technology, as there are smartphone apps that aid providers and patients in handling healthcare issues. One of such apps is called My MedSchedule Plus. It's a free medication adherence app that was launched in 2008. This app automatically schedules medication reminders, allows users to receive medication schedule updates from multiple providers, receive messages from their medical providers, add custom photos of medicines, like the medication bottle, and it also allows patients to track medication adherence. It's available on Apple and Android devices, and it's very, very user friendly. In a study that evaluated about 160 medication adherence apps, My MedSchedule Plus emerged among the top 3 apps based on its reminder features and enhanced capabilities. Some of the features that it did have was that it allowed patients to enter data online through a companion website. So patients were able to log on to a website, so not using their smartphone, but be able to log on to a website and enter data through there that they would eventually be able to see on their website. This app provides complex medication instructions. It stores data on the cloud. It syncs, exports, can print data. It allows for provider input. It can be used on multiple platforms, Android and Apple. It's free, and it provides a statement of HIPAA compliance, and it has a database of medication. So when you're trying to put in a medication, it could figure, it has a database on there. So it's easy to help search through, so you're not putting in medicines that are not being recognized by the database. Some of the things that it does not have is that it doesn't have the ability to track missed and taking doses and the ability to generate reminders without connectivity. So if you don't have Wi-Fi or no means of connecting to the internet, the app unfortunately will not work. But this app would help reduce the rate of medication non-adherence, as it takes away the hassle of remembering what type of medicine, what dose, and how often a medication should be taken. Patients get alerts on their mobile phones, and this would increase the chances of actually seeing the reminder, as people these days have their phones with them for the majority of the time. So these pictures show different interfaces, screens of the app. The one on the extreme left has the patient view, where you're able to see the medicines that you're taking, the times, the dosages, and pictures of the medicines actually. The one in the middle has the provider interface, letting the provider make adjustments and updates to medication regimens. And the picture on the extreme right has a picture of what the website would look like, where you're still able to see the information and put in information, but it looks a little different than it would on a smartphone app. And that's it. Thank you so much for listening to my presentation today. I hope this was very informative, and it would encourage patients to take their medicine and encourage providers to encourage patients to take their medications using mobile phone apps, as they're very handy and they help providers and patients alike. Thank you.